I just want to return to your comment about Heal. Heal is a CNBC Disruptor 50 company, and Heal has this interesting combination of telemedicine and also at-home doctor's visits, sort of doctors on demands. How do you see telemedicine evolving as a result of everything going on during the pandemic? And I'm curious, with Heal, are you doing more in terms of treating people for their everyday illnesses, everyday problems, rather than helping people with COVID via Heal?
We are screening people for COVID as well, but it is absolutely about providing all the health care that people need. And we do it partially through telemedicine, partially through house calls, as you said. And then also we have this remote monitoring so we can continuously watch the patients as well. And, telemedicine, obviously, when things happen, the lockdowns happen, we switched over in a week to predominantly telemedicine. We were about 70% telemedicine in April. We're about 50-50 now. People are starting to have more doctors come back. And it's really important to have the doctor go into your house because you can see all the kinds of things, what medicines you're taking, how you're living, are there fall risks, all these kinds of things. They say that 80% of the determinants of health come from these other issues that you can see if you go into the home. So we think that's super important. And it's going to, be sort of this mix of the three things, that the telemedicine, the house calls, and the remote monitoring, that I think allow us to also provide preventative care, which is going to improve people's lives. They're going to feel better, and it's going to cost a lot less to provide that health care.
Paul, I want to ask you about cities, their tax base, and local businesses in this pandemic that we still find ourselves in and trying to fight out of. I know through Qualcomm, your other businesses, you've been quite a presence and your family has in San Diego for quite a while. What are the challenges that you see that cities are facing with their tax base, revenue base? What are they going to need, either from the federal government or from the business community, to come out of this at least as strong as, if not stronger than they were before?
Yeah, I mean, it's definitely a tough time economically, and I think we want to try and avoid as much shutdown as we can, and that means people, wear masks, like do those kinds of things. But in terms of, certain businesses that, really rely on people being indoors in close contact, that's tough right now. And so San Diego, they've done a thing to allow restaurants, for example, to be on the sidewalks and use parking space and things like that so that you can serve the guests, but have them outdoor, socially distanced. And those kinds of creative things are what's going to get us out of this. I mean, one thing that we know about America is people are innovative. We'll come up with creative solutions. So I think it's those kinds of areas. In terms of support from the federal government, I think it's important. I mean, the federal government's the one that can essentially print the money. And California, we have a balanced budget. So, it's very tough when you have to do that and you see that much revenue base go away. People are trying a lot of things to reduce costs. And we're going to have to muddle through this thing. But we'll get to the other side.